Nerves play an absolutely critical role in the healthy functioning of the human body. But what exactly happens when those nerves become damaged or injured? In this video, we'll fully break down the various effects that can occur when nerves are harmed and how your body responds. Nerves are essentially long bundles of fibers that transmit electrochemical signals back and forth between the central nervous system, your brain and spinal cord, and the rest of the structures throughout the body. This communication allows for physical sensation, muscle activation, organ function, and much more. Any damage or disruption of these nerve fibers results in issues with this signaling system, and that can have wide-ranging consequences depending on the type, location, and severity of the damage. In minor cases of nerve irritation or compression, you may only experience numbness, tingling, burning, or sharp pain in the area supplied by that nerve. This is essentially the nerve's way of signaling that something is wrong upstream and it's struggling to function. Think of a pinched nerve in your neck or wrist that radiates pain signals. Identifying and addressing the cause can allow the nerve to recover. However, in more extreme cases where a nerve is completely severed or divided, like from a deep cut or complete fracture, the downstream portion of the nerve will instantly become completely numb and paralyzed. That's because signal transmission is totally disrupted past the point of injury, so those areas lose input. If this occurs in a limb, the result would be loss of voluntary motor control and sensation. Seek emergency repair for any complete severing of a nerve. Fortunately, peripheral nerves in the limbs and throughout the body do have some capacity to regenerate after acute injury, especially with proper treatment. But complete recovery takes significant time as nerves regrow very slowly. And sometimes this nerve regeneration is imperfect, resulting in some irreversible damage and altered sensations or functionality, like chronic pain or numbness. Chronic nerve injuries or compression can also lead to inflammation, scarring, and formation of neuromas, which are swollen nerve bundles. This further damages the nerves and prevents proper healing. That's why protecting nerves from any additional trauma during the healing process is crucial. The takeaway is that nerve pain, numbness, or loss of function should never be ignored since it always indicates some type of harm or disruption has occurred. Seek proper medical treatment as soon as possible to identify and address the underlying cause, manage pain, and support the healing process. Early intervention leads to the best outcomes when dealing with nerve injuries. In summary, damage to our complex nerve signaling system has diverse effects ranging from minor numbness to complete paralysis, depending on the severity. But given the proper environment and care, damaged nerves often can ultimately repair and regenerate. Let us know any other health topics you want covered in the comments. Thanks for watching, and please consider subscribing if this information has been of value to you.